It is a great satisfaction to greet you, and I hope you find yourself well, both you and your pet. In today's video we will talk about the following: 6 things about bite wounds in dogs. Imperdible. Let's find out now. Since every dog bite wound is a little different, the severity, treatment, and prognosis for each affected dog varies somewhat. But regardless, all bite wounds require immediate veterinary attention. 1. Visible wounds are the beginning. Bite wounds are rarely simple punctures or lacerations, cuts, in the skin. It is important to understand some of the different mechanisms that occur in dog bite wounds to appreciate the possible complications of these wounds. The forces exerted by a dog's teeth when biting include compressive, shear, and tensile forces. The various forces are caused by different teeth and result in different types of injuries. Shearing forces are the simplest and consist purely of sharp lacerations made with the teeth, mostly the canine teeth being the culprit. Compressive forces obviously involve compressing or squeezing a body part between the teeth, which can cause fractures, damage to tissue blood supply, or serious puncture wounds. The premolars and molars come into action. Traction forces result in separation of the skin from the tissues, or separation of the muscle from the surrounding tissues, depending on the severity of the bite. All teeth can exert traction forces, as these forces depend more on the angle of the teeth during bite. 2. The location of the bite matters. Dog bite wounds do not follow a one-size-fits-all approach. Every wound is different, as the location, depth, and number of bites dramatically change the potential problems and outcome. The head and neck are common places for injuries when 2 dogs fight. As a result, damage can occur to the larynx and trachea, the spinal cord, or major blood vessels in the neck, such as the carotid artery or jugular vein. Damage to any of these structures can be serious. Bite wounds on other parts of the body can cause perforations in the chest or abdominal cavities, which can lead to serious infection. Crush injuries can even fracture bones. I repeat, these injuries can have serious or even fatal consequences. The good news is that most bite wounds are not that serious. Most involve damage to the tissues or muscles just below the skin. While all of these injuries require veterinary care, most are not life-threatening. 3. Likelihood of infection. Contrary to popular belief, all mouths harbor bacteria, especially since your dog's dental hygiene probably isn't up to scratch. Bite wounds are considered dirty wounds, meaning they should be assumed to be infected. This is why veterinarians prescribe oral antibiotics to treat the infection associated with these wounds. Topical antibiotic ointments are insufficient. 4. Pain and inflammation. Bite wounds are quite painful. Tissue damage also results in a normal inflammatory response, which is also uncomfortable. As a result, oral NSAIDs, or opioid pain relievers, are almost always prescribed by a veterinarian. Don't give him any over-the-counter pain relievers, including aspirin. There are no safe and effective over-the-counter pain relievers for dogs. Wait for prescription options from your vet. 5. Risk of infectious diseases. Anytime bodily fluids are spread between animals, there is a risk of transmitting infectious diseases. Rabies is the disease of greatest concern with any bite wound, as it is universally fatal and can be transmitted to other people and animals. Babesiosis is another infectious disease that can be transmitted through bite wounds, although transmission by ticks is more common. 6. Common treatment plans. Time is of the essence. If left untreated, the infection can set in and cause more serious problems. Delays in treatment can worsen the potential outcome for a dog, especially if there is any neurological or respiratory damage. After a complete physical exam, a veterinarian may recommend some diagnostic tests, such as X-rays or an ultrasound, or may recommend surgery to explore the extent of the injury. Bite wounds are not closed immediately with sutures or staples, as the tissues at the edges of the wound have been damaged and are unlikely to heal properly. As with all bite wounds, the precise treatment plan varies quite a bit depending on the location and extent of the injury. Anti-inflammatory pain relievers and antibiotics are usually given throughout the wound treatment and then continued at home. The moral of the story is that if your dog sustains bite wounds, be sure to take your furry friend to a veterinarian or emergency hospital right away for immediate treatment. Would you like to have more professional information, and especially updated about your dog? Visit the website below in the description of this video. Do not stop subscribing to the channel, comment, and share the video. You are very well, thank you.